How do you understand medical terms for osteoporosis fractures? Imagine bones as the sturdy framework of your body that keeps you upright and active. When osteoporosis develops, it weakens this framework, making bones more fragile and prone to breaking even with minor stresses. To truly understand osteoporosis fractures, it helps to know where these fractures most often happen and what they mean medically. The most common sites for fractures caused by osteoporosis are the bones that bear a lot of weight or are involved in daily movements. These include the bones in the spine, especially in the thoracic and lumbar regions, where vertebral compression fractures are frequent. These fractures happen when the vertebral body collapses partly or completely, often causing back pain or height loss. Hip fractures are another major concern, especially at the femoral neck, which is the narrow part just below the ball of the hip joint. Wrist fractures, particularly at the distal radius near the wrist, are also common, especially after a fall. These fractures are often called fragility fractures because they occur from low-impact events, like falling from standing height or even minor slips. And like fractures from high-impact trauma, these happen because the bones are weaker due to osteoporosis. Medical professionals classify these fractures to help decide the best treatment. For vertebral fractures, a system called the OW spine, DEGU osteoporotic fracture classification is used. It groups fractures into categories based on their shape, how much pain they cause, and how much the person can move. For example, some fractures are mild and stable, while others are more severe and might need surgery. When doctors describe fractures, they use specific terms. A compression fracture means the vertebral body has collapsed, which is common in osteoporosis. Pathologic fractures happen in weakened bones because of disease, not trauma. Comminuted fractures are when the bone breaks into many pieces, often requiring complex treatment. Stress fractures are tiny cracks caused by repetitive forces, sometimes seen in bones weakened by osteoporosis. Understanding the exact location of the fracture is also key. For example, a fracture in the femoral neck or the vertebral body has different implications and treatment options. The mechanism of injury is important too. Low-impact falls are typical causes of osteoporotic fractures, whereas high-impact trauma usually causes fractures in healthy bones. To assess fracture risk, tools like the FRAX score are used. This score estimates the chance of having a major osteoporotic fracture in the next 10 years by considering bone mineral density, measured by DEXA scans, and other risk factors like age, gender, and medical history. Bone density results are given as T-scores and Z-scores, helping doctors determine how fragile your bones are and what treatment might be needed. In summary, understanding medical terms for osteoporosis fractures involves knowing that osteoporosis weakens bones, making certain fractures more common. Recognizing the typical fracture sites, such as the spine, hip, and wrist, and understanding the classification systems and terminology helps in managing these injuries. It's also important to remember that each person's situation is unique, and medical advice from healthcare professionals is essential for proper diagnosis and treatment. This knowledge helps ensure that fractures are managed effectively, whether through conservative methods or surgery, based on the type and severity of the fracture and the individual's overall health.